Hello, everyone. Welcome to Alohu Foundation Mental Health Lecture Series. I'm Chi-Chun Hu, co-founder of Alohu Foundation and the host for your webinar. Today, Dr. Sommer Bishop will present promoting psychological health and well-being among adolescents and adults with autism spectrum disorder. First off, I would like to thank you all for joining us across the country and around the world. I would also like to thank the Mental Health Association for Chinese Communities for providing simultaneous Chinese interpretation. Thank you, MHACC founder and president Elaine Peng, and thank you, Ida Xiao, for Chinese interpretation. The Alohu Foundation Mental Health Lecture Series aims to make a mental health knowledge common knowledge. Alohu Foundation's mission is to promote mental health, raise awareness and remove stigma surrounding psychiatric disorders, and support fundamental research for cures. Please consider making a gift to Alohu Foundation. Your gift will be 100% invested into Foundation's mission to support mental health. Today, it is my great honor and privilege to introduce Dr. Sommer Bishop. Dr. Bishop is a clinical psychologist and associate professor in the Department of Psychiatry and Behavioral Sciences and the Weil Institute for Neurosciences at the University of California, San Francisco. Dr. Bishop is interested in developing tools to assess autism spectrum disorder and the neurodevelopmental disorder, as well as promoting psychological health and well-being among adolescents and adults on the autism spectrum. Dr. Bishop's work has been funded by many organizations such as National Institute of Health, the Autism Science Foundation, and Simons Foundation. At the UCSF Center for Autism Spectrum Disorders and Neurodevelopmental Disorders, Dr. Bishop participates in comprehensive multidisciplinary assessment and treatment of children and adults with neurodevelopmental disorders. She directs the diagnostic training program, conducting multiple day trainings on widely used autism diagnostic tools and the best diagnostic practices for professionals from all over the world. Today, Dr. Bishop will discuss recent findings about depression in ASD, as well as potential new avenues for improving psychological health and well-being among adolescents and adults on the autism spectrum. Following the presentation, it will be a Q&A session. Please submit your questions using Zoom Q&A function. The presentation is for educational purpose only and is not intended for medical diagnosis. If you have any persistent symptoms, please seek for professional help. With that, I'm going to turn to Dr. Bishop. Welcome, Dr. Bishop.
Thank you so much. Thanks for having me. It's an honor to be here. I can share now? Okay.
Yes.
All right.
Yeah, I can see your slides.
Everybody see? Okay,
yes.
Wonderful. Well, thank you again. It's such a privilege to be here, and good night, good evening, everybody. So I'm going to be talking about some recent data from a study of adults with autism spectrum disorders. And these are the major collaborators on the data that I'm going to be talking about tonight. Julie Taylor is at Vanderbilt. She is an expert in transition into adulthood among individuals with autism. And then Ryan Adams is an expert in peer social interaction at Cincinnati Children's Hospital. Shuting Zhang is my wonderful postdoc at UCSF. And then China Parento and Linnea Lampinen are both research assistants, and they have all contributed substantially to the work that I'm going to be talking about tonight, along with many other people too. So this is a quote actually from an adult who was in a longitudinal study that I was involved in. And he said, when we were talking, he said, I think it's important to know that every autistic person is an individual person, not just a collection of symptoms. It's just like everybody else, different personalities, different sizes, different shapes. And I think especially now with how autism diagnosis has changed and how broad the spectrum is, and the diversity that it just encompasses, this quote is more true than ever, but it was always true in terms of just this being an extremely heterogeneous condition. So even though we have a certain set of behavioral criteria, the way that any of these individual difficulties manifests is extremely variable. So, but importantly, it's important to recognize that people with autism do share, in general, deficits in social communication, which puts them at risk for a number of difficulties related to peer interaction and social functioning. And then also, autism is characterized by the presence of restricted or repetitive patterns of behavior, interests, or activities. And often, as people get older, these kinds of behaviors resolve, but not for everybody. And it can be not only a source of stress or difficulty, but it can also be a real, positive aspect of people's lives too, in terms of being very interested in particular topics, or really finding a lot of comfort in some of these repetitive activities. And then the symptoms of autism must be present in the early developmental period, but there's no specific age cutoff anymore, because what we know is that the demands of social life change over time. And so it may be that as a really young child, somebody doesn't seem different from their peers. It's not until they get into kindergarten or elementary school that the social difficulties become really apparent. Okay, so in thinking just about diagnosis of autism, we're looking both for the absence of expected behaviors, so behaviors that come online for most children early on in development and then progress, at least when it comes to social communication and play behaviors, and also for the presence of atypical behaviors, so unusual sensory interests or preoccupations with certain topics or with playing with things in particular ways. But I'm going to come back repeatedly to this theme of high individual variability, because it's really important to know exactly how somebody's autism symptoms manifest when you're thinking about how to help them. And so what we should expect in terms of somebody's social communication abilities is affected by lots of individual variabilities, like how old they are or where they live or what kind of a family they come from or what their IQ or language level is. And so just a ton of diversity to consider. Okay, so, and this goes for behaviors within each of the domains too. So social communication and social interaction difficulties present in various ways, just as repetitive behaviors can look very different from one individual to the next. So one of the most common questions that I get as a clinician, and whether I'm seeing a 2-year-old or a 10-year-old or even a 20-year-old, is what's going to happen to my child when they grow up? And that answer depends on lots of things that we can predict and lots of things that we can't predict. But a lot of the heterogeneity that I just mentioned, the differences in how somebody's autism presents and whether it's accompanied by significant language impairments or not, or significant cognitive difficulties or not, that's really going to affect likely prognosis. But one of the problems with the adult literature, or longitudinal studies in particular, is that the kids that were diagnosed 30 or 40 years ago with autism are a totally different group than kids who are being diagnosed now. And they also have access, children now have access to really different kinds of services than children did 30 or 40 years ago. So this really limits, I think, the conclusions that can be drawn from existing longitudinal studies. We have to move forward and collect new data on more contemporary cohorts. But it's still important, I think, for kind of contextualizing the experiences of a lot of adults who are living with autism now, that much of the findings that have been reported, they suggest persistent symptoms, so autism-related difficulties throughout the lifespan, but accompanied, by overall general trends of improvement. And there tend to be particularly pronounced decreases in repetitive behaviors, like I mentioned, and then also in certain kinds of social difficulties, but then stable impairments to some extent in things like nonverbal communication and difficulties with social interactions and friendships. But I need to reiterate again that these adults who participated in these studies may be really different from a lot of the adults who are diagnosed with autism now. And so so one of my interests is in understanding the adolescents and adults who are out there now, and trying to figure out what their lives are like, and how we can develop services to make things better. Because I think that what we're up against is this picture, at least with the existing data, that on the whole, people with autism have much lower than optimal rates of functional independence as adults. So if you look at things like employment or ability to live independently, or having meaningful social relationships like friendships or romantic relationships, a lot of these older studies that I mentioned report low rates of those adult kind of success milestones. And so this is from a study in the UK where the individuals were recruited many years ago, but the vast majority were not living independently when surveyed as adults. And then this is also, this is a slightly older group of kids, but not so much as the data that I just showed you, but looking at the National Longitudinal Transition Study, and these are students in the US who have various kinds of diagnoses. And what we see is, compared to kids with specific language impairment or learning disabilities or intellectual disabilities, kids with autism actually aren't faring very well in things like post-secondary education or working for pay. And if you break down samples and look at who has the most success in these kinds of things, we know that better, quote unquote, better outcomes are generally associated with having higher IQ and higher language abilities. But the group that I'm going to talk about mostly today is even among folks who have pretty intact cognitive abilities, or at least are performing similarly to their peers in terms of their cognitive and language abilities. There is so much variability. And we think that certain risks, like for mental health difficulties, may be even greater among individuals with autism with higher cognitive and language abilities. So despite the fact that, that on average, they are capable as a group, more capable of achieving things like independent living arrangements or competitive employment, we see extremely high rates of depression in this group, and it's really become a major public health concern. The other thing that I want to talk about is that, I'm discussing individual level factors, which is traditionally how we've explored predictors of various kinds of outcomes, is thinking about the person with autism and then what is their IQ, what is their language level. But I think it's really time that as a field and as a community, we start to think about all the things that happen outside of the individual, like their family and their community sources of support. So this is just kind of an example of what I mean about potentially greater risk for people who don't have an intellectual disability, who have autism. So this is one of Julie Taylor's earlier studies, looking at a large group of adults with autism and comparing the people who had autism who had average IQ or better, and then the people who had an intellectual disability. And a huge percentage of people, you can see that whole big red piece of the pie on the left, those adults are doing absolutely nothing during the day. So they're not in college, they don't have a job, and they're not doing anything. Whereas traditionally for people with intellectual disability, we had things like adult day services. Even those services have really declined in recent years, but it suggests that we have a different problem to worry about for some of our adults who don't have an intellectual disability. This was a study also by that Julie was involved in, but looking at factors associated with higher rates of employment. And what I think is really important here, just for parents to take home, is that working in high school is the greatest predictor of working after high school, which is not so surprising. But I think sometimes we're so focused on getting kids through school that we forget to think about what's going to happen after school. And so if there are opportunities to practice working in high school, and these, that's more a focus on the vocational track. So when high school students aren't on the regular diploma track, when they're on the certificate track, there's more of a focus on vocation. But for people that we expect maybe to be able to graduate with diplomas and go on to college potentially, there's much less focus on those independent living skills that are so important after high school. And so really trying to get kids into work of some kind, or volunteer work even of some kind when they're in high school, seems to be maybe a good way to ensure that they have employment after high school. And then related to the whole community factors issue, this is maybe one of the most hopeful adult studies that had come out in the last 20 years. And this is by Megan Farley, and it's a small sample. But the reason I wanted to show you this is that compared to the UK sample, where they found that the vast majority of adults had poor or very poor outcomes, this group of 41 adults with autism were rated as having very good or good outcomes. Half of them were. And had much more active social lives and were much more likely to be employed than in other studies. And what I think is interesting about this group is that they were part of a community, a Latter-day Saints community. This is in Utah, and so if you think about having that, in this case, a religious or a cultural community built up around you and supporting you, and that you're a part of, it goes back to that it takes a village. And I think that when we're thinking about people with vulnerabilities, and the idea that we can build up a village and services around them, the outcomes, at least from this small study, look a lot better. So I want my child to have a happy life. I mean, we all want our children to have happy lives. And so I think that this has been one of the most disturbing things that we've seen in the latest adult work in autism, is that we were pushing for so long, oh, we've got to get their language skills up there. We've got to get cognitive scores up there. We've got to give everybody the best chance of success as measured by kind of functional independence as we can. But then even in that group of people who seem like they have everything going for them in terms of their raw ability, we are seeing depression rates that are through the roof. So, I mean, 8 to 10 times greater rates of completed suicides in people with autism compared to the general population. And in fact, I mean, most of the adults that I see aren't coming to me for autism related services. They're coming because they're really unhappy. And they need help achieving a higher quality of life. It's not for help with autism symptoms. And I think really, also a depressing aspect of this recent work is that people are certainly trying to roll out treatments, and cognitive behavioral therapy, remains one of our best evidence-based tools. And we have medication for depression. And so people are furiously working to adapt these kinds of treatments and try them out in adults with autism and adolescents with autism. And when the results come back of the trials, it looks like they're just not working that well in this group. And so my colleagues and I launched a study, and it was really kind of coincidental timing. We launched the study and we completed the first wave of data collection about 3 days before San Francisco locked down for the COVID pandemic. And so we ended up with this group of adults that we had surveyed just before COVID hit. And then we've gone back to them a number of times since after the lockdowns, and so we have some interesting longitudinal data. I'm not sure exactly how they're going to translate to real life after all of this is over, hopefully soon. But I'm going to tell you about some of these findings from this group of adults. So we were lucky enough to be able to partner with the Simons Foundation Powering Autism Research for Knowledge, the SPARK Research Match Registry, and they helped us to recruit 315 autistic adults. And we wanted to work with adults, or understand adults who had received a diagnosis of autism during childhood. So everybody in this sample was diagnosed before the age of 18 years old. And then they were between 18 and 35 at the time of the study. And we had them do a bunch of surveys for us, and this was all remote data collection. So they're from all over the country. And consistent with what a lot of people have been reporting, almost half of them scored above clinical cutoffs on depression measures. And the majority of those, I mean, the good news is the majority of those that we identified as being depressed had been diagnosed with depression before. So this was not the first time somebody was finding them. The prevalence of depression was even higher in females with autism than males with autism. And we see this in the general population too. So it seems like those biases potentially against identifying males who are depressed, they might also hold true in people with autism. And this is just to show the importance of screening and identification, which I know that the foundation is really invested in. but people were significantly more likely to be getting treatment services for depression if they had received a diagnosis, also not surprisingly. But it means that diagnosis is the gateway to treatment services for depression. And so if we don't, if we're not asking questions, and if we're not identifying people with clinically significant depressive symptoms, then they're not going to get appropriate treatments. And then also consistent with studies, not in adults with autism, but just in general, there were major service disparities across socioeconomic status. So people who had fewer resources were not receiving as many services. And adults identified a lot of barriers that I think are important to highlight. And so one of them was financial and insurance issues. That was the most common barrier. And so this adult said, I originally had a therapist, but since I'm unemployed, I couldn't afford to continue therapy long-term, especially with my insurance doubling this year. I cannot afford to receive help anymore. I just take my antidepressants and struggle through it since I cannot get access to any other helpful sources. Also, a number of people identified lack of providers who were able to provide services, and in particular, lack of providers who understood the needs of people with autism. And that's a problem that we see, especially in the adult arena, because a lot of people think of autism as being a childhood disorder, but children with autism grow up to be adults with autism and need services. And then kind of consistent with what I was saying also from previous studies, suggesting that these treatments may not be working as well as we'd like them to in this population. The adults in our study were reporting to have been in depression treatments for an average of 5 to 6 years, which is a really long time to be in treatment for depression. So they still have it. They're still depressed. So going to therapy for 6 years and still being depressed is not an ideal scenario. And it's really incompatible with insurance-based care systems where we're supposed to be able to make everybody better in 16 weeks. And then I told you that we happened to survey them right before COVID started. And then we went back to them a few weeks later because we wanted to see, or a couple months later, we wanted to see how the initial weeks of the pandemic had affected this group, since the timing was perfect to do that. And one important finding here was that people who started out as more depressed were more likely to have increases in their depressive symptoms. And so this just suggests that, it's the same old story of the most vulnerable are the most vulnerable, and that people who are having a hard time to begin with are likely to have an even harder time when something like a global pandemic hits and everything in life changes. So, but we saw, as with all of our autism studies, large individual variability and patterns of change. And so therefore an opportunity to investigate, what individual level factors might matter for thinking about depression treatments. And so, the big question that I have, which unfortunately I can't answer yet, but we're trying to develop studies to be able to do this better, is what do different people with autism, or really any people, what do they need to be happy? And what predicts well-being in this population, and what services are most likely to be useful? This was one of the most formative clinical experiences of my whole life so far. These are pictures from my adult social group at Michigan, and we met once a week all through graduate school, and when I was there for postdoc, and then it continued on afterwards. And I think many of them are still meeting every week. But why I'm bringing this up is because I think that sometimes really pretty inexpensive services like social groups can be very meaningful to people, because they create a community of peers and a support network, and just having somewhere to go once a week where people care about you is really can be life-changing, I would argue. But that's going to vary a lot for different people. And some people are going to need a lot more than that. And some people maybe aren't even going to want that much. And so one of the things that we asked in this study with the 315 adults who I'm telling you about is we asked how much time they were spending in different kinds of social activities. And then we asked them what they thought about that, whether it was too much time or too little time or about right. And so there were associations between how much time they thought that they wanted to spend on the activities and depressive symptoms. But this was mediated by loneliness. So what we think is happening is that people who aren't having their social needs met, whatever those are for them, and it's going to be different for different people, but people who aren't having their social needs met are feeling lonely, and then that's leading to increases in their depressive symptoms. So we have many interventions that are really designed to increase the amount of social experiences. So let's just get people more. Let's get them more hangouts with friends. Let's get them, more social opportunities and interactions. But while quantity may be important for some people, it shouldn't be the only thing we consider, and we need to consider what an individual actually wants for social interaction. And considering those needs and preferences that are likely to vary a lot across people is super important. And then ultimately what it comes down to, I think also, is not how much time they're actually spending, but what their perceptions of the adequacy of that time they're spending in different social interactions is. So again, just a plug for, we may be able to create some structured or semi-structured activities and social opportunities that meet the needs of some people without just putting it all on an individual person to go out and make a friend or get a date, or these things that can be hard to do, especially when you have significant social impairments and or social anxieties. The other thing that really seems to matter for depression in the general population, and we think that this is very much true in adults with autism too, is employment. Most adults without disabilities have jobs. And so when you're taking a group of people who are very capable in many ways and they don't have gainful employment, how could we not think that there's going to be an association with depression? And so I think here what we found was that there were high rates of negative job changes after COVID-19 hit. They were losing jobs or having reductions in hours. And we saw increases in depressive symptoms when that happened to people. And then in general for the whole group, and this has been found elsewhere too, but that higher levels of mental health symptoms are associated not only with, kind of lower likelihoods of being employed, but a higher likelihood of having ever been fired too. And so it's bi-directional. Mental health difficulties increase your risk of having problems on the job, but then problems on the job are also increasing your risk of mental health problems. But I think that this underscores for me the importance of really thinking again outside of the individual with autism, and how can we get folks employed in things that are meaningful for them, or at least even if the job isn't a favorite activity, the act of earning and being able to contribute to your own livelihood can be meaningful. Another little study, and this was led by Linnea Lampinen, but she was interested in looking at sleep. And I know that you heard from Lauren Asarno a couple months ago, and she helped us with this, and she's a sleep expert. But we know that autistic adults reported high rates of sleep disturbances in previous studies, and that was the case here too. And what we did was we controlled for a number of other variables that might affect both sleep and depression, and found that even after accounting for those, that people who reported lower sleep efficiency or delayed sleep phase, so going to sleep really late, were more likely to have higher levels of depressive symptoms. And so here is another situation of chicken and egg bidirectionality. Are you depressed because you're not getting enough sleep, or are you not getting enough sleep because you're depressed? But regardless of what comes first, we know that people feel better when they sleep better. And so thinking about targeting somebody's sleep, given the high rates of both sleep disturbances and depressive symptoms in this population, it's just a new way to think a little bit potentially, rather than just treating the depressive symptoms. Let's start to make changes in the life of the person that may be either causing depressive symptoms or maintaining depressive symptoms. So we'd like to see future research examining the effect of sleep treatments on depression in these adults. Just a couple more slides, and then I think we'll have lots of time for questions. But I think one other way to individualize treatment potentially is to ask about the little things, and what are the things every day that make people happy or unhappy. And so we did this. We said, in the last week, what were some things that made you feel happy? And in the last week, what were some things that made you feel unhappy? And the results were, just like we have found in non-autistic populations, but a lot of focus on social partners and social interactions. So being able to see friends, neighbors, and loved ones, going to the park with my daughter, activities, pets, these are things that make people happy. Social partners are also a source of distress or unhappiness. So, losing a family member or having an argument with a family member or a friend. And then current events were also stressful, like the coronavirus, and then difficulties at work. And so these are themes that have been identified in studies of people without ASD, and underscore also that, what happens, little things that happen to you on a daily basis can make a big difference, positive or negative. But we've got to think about mood changing experiences and in the context of things like social relationships or interactions or daily activities like jobs. And if you don't have a lot of that stuff going on in your life, if you're really not engaged in very many activities that are meaningful to you with people whom you love, that it really reduces your chances for mood boosting activities, and that's important. So we need to individualize treatment planning in such a way that encourages experiences that really make people feel better, and then teaches positive coping skills when negative experiences do occur. And this is limited because we were just asking retrospectively, and there are ways that we might be able to ask in real time and in more depth. But the point is that I think we've got to ask people, and that should really be a part of the treatment plan too. What do you like to do? What makes you happy? Not thinking so much of the depression as just this thing, but maybe for some of these folks, the depression is really a natural consequence of having a life that is not as fulfilling as you'd like it to be. So just to kind of sum up the different studies that or the different findings from this, largely from this one study of these 315 adults, We found very high levels of depression and sort of questionable access and questionable effectiveness, as a lot of people have found previously in this population. But it's clear that we need to improve service access and quality of services. And it's not for lack of trying that these things aren't effective. It may just be that we need to think about things in a slightly different way, and consider individual needs and preferences and perceptions a little bit more than we have been. Because I think importantly, sources of depression are likely to vary. So for a lot of people, it may be, it may be similar to more organic or biological sources of depression, like we see in a lot of folks who don't have autism. But for some people who have autism and who have really difficult life circumstances, their depression may be initiated and maintained by primarily by difficulties in the larger life context. And it's possible that by targeting those in various ways that we could really improve psychological health and well-being. So I think looking beyond standard depression services or treatments to promote well-being in this group is going to be important. And being creative and adapting. So when something doesn't seem like it's working, we've got to try something else. So I want to thank all of the participants who shared their time with us for this study and for all the other studies that I presented. Without the families and the people with autism, we would know next to nothing. And so we really wouldn't know anything at all. So it's because of them. So thank you. And I'm happy to take questions and hear all of your thoughts and experiences too.
Thank you, Dr. Bishop. Very nice, very informative. So now we're open up to Q&A session. Before we talk about that, we have a couple of pre-submitted questions. Actually,
yeah.
You provided us with some links, very useful links, and so we posted in the chat box to everyone. Some people said they cannot copy it down. I believe you can click on the link and your browser will lead you to the website and you can bookmark those websites and for your future references.
Yeah, I had asked my team, my colleagues about their favorite resources, and the OAR, the Office for Autism Research, and Autism Speaks, they have a ton of different toolkits covering all different issues. So I thought those were good ones. And then the other was out of North Carolina and kind of promoting this positive coping that I mentioned briefly.
Yeah, that's good. That's a very good, useful information for audience. Okay, so we have many questions coming in regarding Asperger syndrome. So we just summarize it and put it into a more generic question. So the first question is, how to help kids diagnosed with Asperger syndrome to manage schoolwork and to navigate social issues?
Yeah, well, it's a really important question. It's a really big question. And I should have mentioned too, Asperger syndrome in the DSM-4 was its own category within pervasive developmental disorders. But when DSM-5 went to this autism spectrum disorder, one giant category to include everybody, it usurped the Asperger syndrome designation. So, so I think a lot of those individuals that I was talking about today with higher cognitive and language abilities, they would have been called Asperger syndrome, and many of them still do identify as having Asperger syndrome. So how do we help people do better in school and do better with their social interactions? So I think, it's got to be very individualized, and the ideal situation is that you have somebody to really help your family navigate all of the multiple systems and just pick one goal off at a time, because mean, what can be really overwhelming for families is that there's just so much to manage. And so there's this academic part of school, but then there's the social part of school. And then there's, all of these considerations that can vary so much. So I think that there are a number of treatments for trying to improve social skills in adolescents and young adults with autism. And so that's one idea, but I think potentially even more meaningful than that is if we can try to, not focus so much on the skills necessarily, or focus on the skills at the same time as we're trying to figure out social opportunities or extracurricular activities or things that bring people joy, where they can develop those skills and practice the skills that they're learning. But specialized help at school is often really needed through things like an IEP. And if you want to, I'm happy to try to help with more details if you want to email me.
Okay. Yeah, it definitely will. Yeah.
Yeah.
Okay. So the next question, can you speak to how a therapist would work with a person on the spectrum who has selective mutism and seeks to be able to speak?
Yeah. Another really good hard question. So there are therapists who really specialize in selective mutism and helping people feel more comfortable talking as part of therapy. I think that engaging in the therapy is often a tricky point for people who have anxieties or selective mutism type things that might be getting in their way. But I think it probably comes down to a really good fit with a therapist who knows what they're doing and who is willing to work through that. Because lots of people aren't necessarily ready to just spill everything on the first session.
Mm-hmm. Okay. There are many local shortages of appropriate psychiatric and psychological services that are insurance preferred provider list. Is that a national problem?
Yeah, it's just a national crisis. We have years-long waiting lists for every kind of service, from diagnostic assessment to treatment, and psychiatrists are in particularly low supply.
Yeah. Okay. So that's a big problem, I think. Yeah. People
huge problem. So
yeah.
people can't, even when they're reaching out, they can't get to the doctor. That's right. Yeah.
Oh, since you talk about employment, a question regarding what kind of jobs are good for autistic teens.
Mm-hmm.
And another question is, if a person might pass at the workplace, I think when is a good or bad to disclose to one's prospective employer, and in general, when is appropriate to disclose?
Yeah. So always I feel like I'm cheating, but all my answers are depends. So sorry about that. But I do have some articles that I can send about some recent articles on the issue of disclosure, because people have actually studied this, and it depends on the on the person with autism, and it depends on the employment situation. But disclosing disability can be really useful in some situations. There are just things to consider. So I will send those to you right after tonight. And maybe, is that okay? And then we can distribute
no problem.
those.
And then we will forward to the audience. Yeah.
Okay. Excellent. And then the other is about what jobs. And I think that probably like any job that's teaching some basic skills in just showing up and having responsibility and having the opportunity to collaborate to some degree with coworkers, but the level and the type of collaboration may depend a lot on what the person's social preferences are and what their social strengths are. So some jobs may be way too socially demanding. Some may not have enough social interaction. So I think being really sensitive to that and working. I mean, as adults, job coaches or Voc Rehab can be a helpful resource, but the problem with teenagers is that it's often just parents begging, I think, their friends to say, hey, can you employ my kid? Or trying to come up with situations where they can employ them in their own business. But I think it's worth doing and working together as a community to try to make these opportunities happen.
Mm-hmm. Okay. Yeah, I think because of the variation of each person's situation is quite large. So it really depends. Yeah. Okay, so next question. Are there common comorbidities that can make social interactions more difficult?
So I think that really, the more you have, the more comorbidities, the more difficult lots of things are. But we know that, depression all by itself can make social interaction more difficult. And so if you have autism and depression and or anxiety, a lot of people with autism have severe anxiety or and social anxiety that can make social interaction more difficult. And then for people who have intellectual disabilities or language impairments, social interactions can be more complicated by those factors too. So yeah, in general, the more things that somebody has going on, probably the more specialized approach we need to take to figuring out what sorts of social interactions are actually going to increase well-being. Because there's some evidence too that, not everything is good either. So you could be involved in a lot of social interactions and be having a lot of negative consequences, like from bullying or peer victimization or from just the stress of it. And so that's why it's not all about quantity. It's really about quality too.
Mm-hmm. Okay. Next question, as many of them may not have a sexual relationships, what impact to their physical and mental health if their sexual desire and needs cannot be met?
Yeah, I think so the one of the things that people have been better about the last 10 to 20 years is actually talking about autism and sex, because lots of people with autism are interested in sex, even if they're not having sex. So that's absolutely right. We need to think about sexuality and sexual health as an aspect of adult life that's important too. And people's interest and capacity to consent is going to really differ across the spectrum too. But it's important to have professionals who are comfortable kind of asking those questions and talking about those things, and helping people figure out how to make that a part of their life if they want it.
Okay, and the next question, actually, I've seen the similar question, several times. What are ways to detect the depression or anxiety in kids with autism when they have difficulty communicating and expressing feelings?
Yep. So assessment is a whole different ballgame when somebody doesn't talk as well. And that's one of the, I think, major limitations of adults disability work, is that most of our measures for adults are built on the assumption that somebody can easily report for themselves. And so that's not the case in everybody. But what we tend to see is, increases in certain kinds of behavior problems. So people might act out, or really, I mean, some people who don't talk still seem really sad. And so depression may manifest in ways like that, or in aggressive or other acting out behaviors, or just, I think whenever anybody's really shows a change, whenever there's a change at any point in life, it's important to pay attention to it and say, they weren't acting like this a year or two ago, and now they are. So let's get to the bottom of this. But it is definitely, assessment can be challenging. And I think we have to look there at the life circumstances too, and what may have changed. Somebody asked too, what are parents to do, like what happens after a parent dies and leaves a very disabled child alive. And that is the greatest fear of every parent.
Mm-hmm. Yeah, actually, we do have such a question that,
yeah.
What to,
yes.
If parents passed away, who can take care of their autistic kids? I think that's everybody's fear.
It is. Yeah. It's everybody's worst nightmare. And I think that, and as a society, we have not done a very good job of taking care of other people's children. And so there are disability lawyers are really good to have to try to set up trusts. And then I think also, building as much of a community around your son or daughter, and so that it's not just you. But as part of that, what I was going to say is that sometimes, there can be really significant changes, like when a parent dies, and then we see the adult with autism acting out. Well, of course, they've just lost somebody really important to them, even if they can't talk about it. So the first response shouldn't be, oh, let's put them on more medication necessarily. The first response needs to be, let's look at what happened in this person's life and figure out how we can cope with it. Without just rushing to assume that it's something internal. There can be external factors too, I guess is the point. We got to look at those.
Yes. And sometimes grief looks very similar like depression.
Yes, exactly. Yeah.
Okay, so next question. I think you touched based on that in your presentation, but I think audience wants to have a little bit more details. So the question is, does cognitive behavior therapy, CBT, help or not?
So I think it's one of the best
with the depression.
Yeah, it's one of the best tools we have. And so we've got to try it. And there are modified CBT protocols for kids and for people with autism. And I think finding a therapist who knows CBT, but also ideally knows something about autism, that would definitely be my go-to behavioral therapy. Another therapy that is kind of gaining some attention is behavioral activation therapy. And it involves a lot of the principles that I was talking about, where maybe we can't change how somebody's thinking right away. Maybe we need to change what they're doing. And then hopefully that has downstream effects on how they feel.
Mm-hmm. Okay, so if you can start very early, what helps the best with coping mechanisms for depression and anxiety that you can teach over time?
Yeah, I don't have a good answer, because I think one of the things that we haven't done yet is we haven't seen the onset of depression. What we know is that there's a really high rate and then it's pretty stable, but we need to learn a lot more about because you're talking about preventative techniques too.
Right, that's right.
And I think that's a clear next step.
Mm-hmm. Okay, so we're still need more
but
research
I
on
think
that.
in general kind of emotion regulation strategies, and then trying to be really protective of people. I do think that we need to think about how to be protective of people's social experiences, in the sense that we need to preemptively try to prevent like negative peer experiences and things from happening, because I think that leads down a road that is not good.
Okay. So Dr. Bishop, we're at 7:30. Can we have maybe 2 more questions?
Oh, I have
Okay.
all night, so
Okay.
I'm all yours.
So let me see. Any research on diet and depression in autism?
I actually don't know the answer to that. So so there's research on diet in autism, and a lot of the studies have just kind of not concluded overall positive benefits, but some families really swear by diet changes. But I mean, I wouldn't be surprised if diet, diet affects our mood. So that's another good thought, looking at some of the, not just changing the autism symptoms, but changing people's
overall
mood. Yeah.
Yes. Okay, this one, I'm not sure we have such a statistic. Do you know what is the current unemployment rate for autistic adults?
What the unemployment rate is?
Right. For autistic adults.
I should know that off the top of my head, but I don't. I think it is very high, and it's going to differ a lot. So if we're talking, if we take people with an IQ in the intellectual disability range versus in the average range, it's going to differ, and it's going to differ for various reasons. But I can find that out too. I can find out. I have a good resource that I can find out for you.
Okay, all right, that would be good. And I believe that definitely this unemployment rate is gonna come up, during the pandemic.
Yeah, and what we did see was, I think it was something like 25% of our sample who was employed experienced negative job changes within 6 weeks of the pandemic. So in the first 6 weeks after COVID, a quarter of the people who were employed had either lost their jobs or lost hours. So that gives you a hint, right?
That's a big impact.
Yeah.
Okay. All right. I think that there's a question to me is, where is the recording going to be available? Okay, so we record this presentation, and we are going to edit it and send it back for you, Dr. Bishop, for approval. And then once you're okay, and we're gonna put it on the YouTube, and we'll put a link on our website, Alohu Foundation website, so anybody can access. As a matter of fact, I think everybody can access our previous lectures. So we have all the links over there. You can also sign up a Alohu Foundation YouTube channel, so you will get automatic notification for all the upcoming webinars whenever we upload it in the YouTube. So thank you so much, Dr. Bishop, for the very nice presentation and the Q&A.
Thank you for having me.
Yeah, thank you so much. And I also like to thank everyone joining us, and please help us to fill out a short survey at the end of the event, and stay tuned to our future lectures. And thank you, stay safe and stay healthy. Bye-bye.